Good morning, class. Today's topic for discussion is radiographic landmarks of the mandible. We shall discuss the radiographic landmarks of the mandible so as to help us to interpret an IOPA or an intraoral periapical radiograph. So we shall start taking the mandible part by part. So coming to the mandibular incisor region, the region A is the lingual foramen. Lingual foramen is a tiny foramen which is present in the periapical region of mandibular incisors. Surrounding the lingual foramen, you have a radiopacity or a prominence in the surrounding the lingual foramen, that is the genial tubercles. B indicates the genial tubercles, and the area C, which is a radiopaque band which is starting from the midline, both extending to the right and left sides of the mandible, is the mental ridge. The area D is a mental fossa, which is a relative radiolucent area which is present between the interdental region of the mandibular incisors. Again, we shall see many figures and many diagrams where you can see all these regions properly. So coming to the corresponding parts in the right mandible, you can see the region A, that is the lingual foramen, which is present in the lingual aspect of the mandible as a tiny opening where the incisive nerves and vessels pass. And the area B is the bony prominence surrounding the lingual foramen. You can clearly appreciate a bony prominence surrounding this foramen that represents the genial tubercles. The second figure, you can see the area D, that is present in the labial aspect of the mandible as a depressive region in the periapical region of the mandibular incisors. That area is seen as a relative radiolucency in the radiograph. And the area C, which is starting from the midline region, is extending both to the right and left sides. That represents the mental ridge. Again, another figure showing the genial tubercles. In the first figure, the white arrows indicates the genial tubercles, and in the corresponding radiograph, here in the canine, you can see a peculiar feature, that is, you have a bifid root canal in the mandibular canine, which is usually rare. And also, here the white arrows shows the presence of genial tubercle. Coming to the facial view, here you can clearly appreciate the presence of a bony prominence in the labial aspect of the mandible, which is indicated by tiny red arrows. These red arrows indicate the presence of a mental ridge or the bony prominence which is extending from the midline region both to the right and left sides. In the radiograph also, this radiopacity is mentioned in the periapical region of this mandibular incisors. Another diagram where you can clearly see the mental fossa or a depressive region in the labial aspect of the mandible and seen as a relative radiolucency in the periapical region of the mandibular incisors. Here in this figure, there is a radiolucent lesion which is present in the periapical region of the mandibular incisor. But this should not be mistaken for mental fossa, because here it is the associated periapical lesion or a periapical abscess associated with this mandibular incisors. Here you can clearly see the lamina dura of these three teeth is missing. So here we can also, by confirming the vitality of the mandibular incisors, we can clearly see this is the periapical lesion associated with mandibular incisors and not the radiolucency of the mental fossa. And in the second diagram, the orange arrows indicate the nutrient canals. Nutrient canals is seen as a thin radiopaque bands which is passing through the interdental region or till the periapical region of the teeth. Here it represents the canals, nutrient canals, and the study shows that nutrient canals are more prominently seen in patients with hypertension. Now coming to the mandibular canine region. In mandibular canine region, again you can see the portion of a mental ridge which is passing through the mandibular canine as well as the mandibular premolar region, that is the mental ridge. And the region genial tubercles might be also seen in the a portion of a mental genial tubercle can be also seen, and the area C is a mental foramen. C is a little bit bigger foramen compared to lingual foramen, and it is seen between the mandibular premolar region. Now to see the corresponding parts in the mandible. In the mandible, you can see the area C, which is the mental foramen, and the area A is the mental ridge. And in the second figure, in the lingual aspect, you can see B1 is the presence of genial tubercle here, and B2 is the lingual foramen. So mental ridge, it is the raised portions of the mental protuberance which is sloping downwards and backwards from the midline. So a portion of the mental ridge can be seen extending from the anterior region and extending almost till the mandibular premolar region. Another figure where you can clearly see where what you have the prominence in the genial tubercle as well as the foramen referred to as the lingual foramen. Here, the white dotted lines shows the path of the inferior alveolar canal, which is ending till the mental foramen. In the corresponding radiograph also, here the blue arrow indicates the mental foramen, whereas the red arrow shows the path of the inferior alveolar canal or the mandibular canal. Coming to the mandibular premolar region, you have A, if that is a radiopacity which is passing through the periapical region of the mandibular molars, that is the mylohyoid ridge. And the area B is the mandibular canal, which is a radiolucent path which is seen passing through the body of the mandible, that is about 1 centimeter from the mandibular molar roots can be seen, that is the mandibular canal. And the area C is a relative radiolucent area which is seen in the whole periapical region of the mandibular premolar as well as mandibular molar area, that is the submandibular gland fossa. And the area D is the mental foramen. To see the corresponding parts in the mandible, again you can see the white dotted lines indicates the path of the mandibular canal which is passing through the body of the mandible, whereas the area D is the opening of the mental foramen. And in the lingual aspect of the mandible, you can see a bony prominence which is appreciated in the cervical aspect of the teeth, that is the mylohyoid ridge. Mylohyoid ridge is otherwise referred to as the internal oblique ridge. And the area C is a depressive region in the lingual aspect of the mandible, and that is the area where the submandibular gland rests in the lingual aspect of the mandible. That area is referred to as the submandibular gland fossa. Coming to the lingual view, the mylohyoid ridge is clearly seen in this diagram. Here, sometimes in certain radiographs, you cannot really appreciate the mylohyoid ridge. But here in this radiograph, you can clearly see the thick band-shaped radiopacity which is passing through the periapical region of the mandibular molars, that is the mylohyoid ridge, and the mylohyoid ridge is again called as the internal oblique ridge. In the facial view, again another radiograph where you can clearly see the inferior alveolar canal. Here in this inferior alveolar canal, we can clearly see that the radiolucent path is bordered by a thin white radiopaque rim both in the superior as well as the inferior aspect. And in the lingual region of the mandible, again there is a depressive region where the submandibular gland is resting. That region is submandibular gland fossa. Here the white black arrows shows the submandibular gland fossa. The white arrows again showing the mental foramen, and you can see there is a seen as a oval shaped radiolucency which is present in the periapical region of the mandibular premolars, that is the mental foramen. Here the red arrow shows a periapical region associated with the mandibular premolars, and it should not be mistaken for mental foramen. It can be confirmed by taking the vitality test for the mandibular premolar, and you can see a very deep restoration present in the mandibular first premolar. So in the first premolar, you can see also the lamina dura is absent, and you have a periapical lesion associated with the mandibular first premolar. And here the mental foramen is present between the roots of the first and second mandibular premolars. And in the second radiograph, here the yellow arrow shows the periapical lesion associated with the mesial root of mandibular first molar, whereas the green arrow shows the area of radiolucency or an oval shaped radiolucency of mental foramen. Coming to the final region, that is the mandibular molar region. So far, we have discussed the mandibular incisor region, we have discussed the mandibular canine region, and then the mandibular premolar region. Now coming to the mandibular molar region. So here we have seen the mylohyoid ridge, that is A. A shows the external oblique ridge, that is the continuation of the anterior border of the ramus, and the mylohyoid ridge is seen as B. So you should not be mistaking between the external oblique ridge as well as the mylohyoid ridge. Mylohyoid ridge is also referred to as the internal oblique ridge. So external oblique ridge is the continuation of the anterior border of ramus, which is more seen superiorly in aspect to the mylohyoid ridge. And B is again a radiopacity which is passing through the periapical region of the mandibular molars, that is the mylohyoid ridge. Near the mandibular canal, a portion of mandibular canal passing through the body of the mandible is seen also in the mandibular molar region, and the area D is a relative radiolucent area which is present in the periapical region of the mandibular molars. To see this corresponding region in the mandible, you can clearly appreciate the area A, which is passing as a continuation of the ramus of the mandible. That is the external oblique ridge. And whereas you can see C is the mandibular canal, and in the second lingual view of the mandible, B is the prominent bony prominence referred to as the mylohyoid ridge, and the area D is a depressive region, that is the submandibular gland fossa. So here can we see all the two ridges as well as the fossa as well as the mandibular canal. So C is the mandibular canal, which is bordered by a thin radiopaque rib, both in the superior and inferior aspect. The area D, which is surrounding the periapical region of the same molars, is referred to as the submandibular gland fossa, and the area A, which is passing through the cervical aspect of the mandibular molars, is the external oblique ridge, whereas inferiorly you have another radiopacity which is passing through nearly through the periapical region of the mandibular molars, that is the internal oblique ridge, or otherwise referred to as the mylohyoid ridge. So again, a radiograph showing both the external oblique ridge as well as the internal oblique ridge. Here, in the white arrow shows that corresponding prominence of the mandible in the lingual aspect of the here, and in the radiograph it is shown as a black arrows. Mandibular canal showed by the white dotted region. It is starting from the mandibular foramen and almost ending till the mental foramen. Again, here in this radiograph, we can clearly appreciate the radiolucency which is present in the mandibular periapical region, and it is an extensive region. So it will not be converted or miscalculated for a periapical lesion. So here in the first radiograph, the blue arrows shows the mylohyoid ridge, whereas the red arrow shows the external oblique ridge. So in the second radiograph, you can see it is a foreshortened radiograph where you can also see the inferior border of the mandible. Here you can clearly appreciate between these two ridges. And here the red arrows again shows the mandibular canals. And you can see a dilacedated root in this mandibular third molar. So you can think it will be a difficult extraction. And in the second radiograph, you can see here both the crowns of the mandibular molars are facing each other. This condition is referred to as kissing molars because the crowns of the impacted tooth are facing each other. So let us conduct a test so that we can check whether we have understood all the landmarks of the mandible properly. So I will show you 4 slides. Can we identify all those anatomical landmarks? I'm into slide number 1. Can anyone tell me what is the small radiolucency which is present in the periapical region of the mandibular incisors, which is shown by the green arrow? Yes, it is the lingual foramen. So the tiny radiolucency which is present in the periapical region of the mandibular incisors is the lingual foramen. And what about the radiopacity just surrounding this lingual foramen, which is seen as a circular radiopacity? That is the genial tubercle. Now coming to the slide number 2, here you can see blue arrows. Blue arrow is indicating towards a thick radiopaque band. And what is this thick radiopaque band? That is the mylohyoid ridge. And what about the orange arrows? What does it indicate? And the orange arrows indicate the path of the mandibular canal. Coming to slide number 3, what does the red arrows indicate? The red arrows point towards the portion of a mental ridge, and you can see that it is starting from the mandibular midline region and extending both to the right and left sides of the body of the mandible. Now coming to the last slide. Can anyone identify what are the red arrows identify? The red arrows is showing the path of the inferior alveolar canal. And what about the radiolucency which is surrounding the canal? The radiolucency which is extending to a vast area surrounding the mandibular molar region is the submandibular gland fossa. And this is the key. The first slide showed the lingual foramen. The second slide shows the mylohyoid ridge as well as the submandibular gland fossa. The third slide, the mental ridge. The fourth slide, the mandibular canal along with the submandibular gland fossa. Thank you, class. So we should study all this topic clearly, and it will help us to interpret an IUPA. See you in the next class.